this month. That is absolutely incredible. All right, well, more cases of measles are being linked to an outbreak at Disneyland, and officials fear there could be more. Now, the state of California confirmed Monday 26 people who visited Disneyland last month have come down with the virus. A county health official confirmed other cases yesterday. The outbreak has spread to other states. 2 of those infected live in Utah, another in Colorado, and another in Washington. At least 4 other suspected cases are under investigation. And joining me now is Dr. Frank Esper, infectious disease specialist at UHK's Medical Center in Cleveland. Doctor, it's great to see you again.
It's good seeing you here.
Okay, so let's focus in just on Disneyland here. We know that there's been an issue in the NHL as well, and we can talk about that. But first of all, how do you contract measles? Is it something that you have to be in close contact, or if you ride a ride after someone who is infected, you can get it?
You know, the answer is that measles virus is actually a cold virus. And just like cold viruses, when we talk about the regular colds and the flu viruses, most times people get measles when they come into close contact in close quarters with someone who is infected. And so that could be as simple as just standing in front of a person, but a lot of these viruses can live on places like doorknobs or countertops, and they can last for several hours. People get it, those viruses, the countertops onto their hands, and then from the hands they can get back into the nose and mouth, and then the infection persists.
Disney Chief Medical Officer released a statement saying we are working with the health department to provide any information and assistance that we can. But as you well know, beyond Disneyland, as I mentioned, the National Hockey League dealing with a couple of players who've come down with measles. Does it all come back to parents not taking their children in for the necessary vaccinations? What's behind this?
You know, the answer is that our country is bombarded with a lot of different infections from abroad. There are always little pockets of mumps or pockets of measles that are happening, and we just saw in the late last year we had Ebola epidemics that can be brought onto our country. Thankfully, the high vaccination rates that we have in our children and in our adults in this country prevents this infection from becoming established. However, because there's always going to be people who are unvaccinated or undervaccinated, or individuals who just cannot respond to the vaccine because their immune system is low or because they're undergoing chemotherapy, there's always going to be a susceptible population. When you get people who come together from all over the world in places like these international amusement parks, or sometimes we see them after the Olympics or the World Cup, where people from all over the world come together, you're going to get spread of infections, and those people who are not vaccinated or do not respond to those vaccines can then contract the disease.
And I should correct myself, not the measles with the NHL, it was the mumps outbreak. With that said, with those parents who might be looking ahead already to spring break and maybe some other places where your kids will be in close contact, they are the most susceptible, like the elderly. What do you do?
You know, the answer is that, just as I said, the measles is a cold virus, and there's a lot of things that you can do to prevent this infection as well as others. The best thing that you can do is wash your hands. Most viruses, colds and flu viruses, need your hands because they get onto your hands and then they get into your mouth, because we touch our mouths and our foreheads and our eyes all the time, every day. And that's the entry point. So if we wash our hands, we are preventing a lot of infections from getting into us. Other things we could do: if we are coughing, we cover our cough. We prevent spread to other people. If we feel sick, we try to stay at home or to avoid contact with those individuals. But the measles virus, thankfully, a lot of us already have a lot of immunity because most children got vaccinated when they were 1 and then again when they were like 4 to 6 years of age.
All right, Dr. Esper, thank you so much for your time. We greatly appreciate that. So up next, our News Nation Gut Check. Elementary school teachers say students need more class time to meet Common Core standards. But should recess be on the chopping block?